A Nigerian was actually shocked using a Ghanaian hospital for the very first time. She said what she experienced in a Ghana hospital is totally different from what she is experiencing back home in her home country. Guys, her experience is mind-blowing. We're going to be watching the video together. Don't forget to like the video, share the video, and subscribe to the channel.
Okay, so a quick one. So when I relocated to Ghana, I was looking for a very good hospital to have my second born because I was scared of, complications. I've had complications before, so now I wanted to be very cautious of the hospital I go to. So I was looking for this big hospitals, I was looking for them and estimated like 20,000 Ghana cedis for delivery. And then my mom was like, "Mother, Musora says it's Kadodo. Mom, Musora na mo go hospital. I said, "Yeah, dad, I'm not musika." And then she was like, "Kwadabraka polyclinic." I was so doubtful. I was like, "Hey, polyclinic, okay." And then I tried it. I went to the polyclinic. When I got it, it was so nice, extremely nice. And they were like, "Oh, don't you have health insurance?" I was like, "Hey, insurance card there. I will not go there because I don't know your insurance. Even when they are taking care of you, cry don't be winichi." They were like, no, I should do my. So I went to do my insurance, and when I went back to the hospital with the insurance, like I ended up paying like not up to like 1,000 Ghana cedis, but the service was 100% on point. Like I was doubtful of government hospital, but like they are so accommodating, so nice, smiling nurses, so nice chatting. Like they tell you everything while you're in the delivery process. They check up on you. I love the hospital. If you want to deliver, I recommend Adabraka. This is free advertisement. I'm not paid to do this, but I really love their services and I'll love to go there again, but I'm not having children again.
Percent of whatever the costs you incur.
In the developed world, they have different insurances. Some are VIP, class A, class B, class D, class E, class F. Okay, so depending on the one you can afford, but at least you should be able to afford one for yourself. And they hire the insurance
determines
hospitals you are going to be attending, because the hospitals for VIPs and class A is not the same as what someone with insurance of class D type is going to attend or use, except if you have money to pay, like good money to give to them. Anything that has to do with health is very essential, and it's very important to take care of our health. We should not wait till we are totally down at the point of breaking. That is when we start seeking for medical solutions. But when you have your insurance card, you can confidently wake up. You are having headache, see a doctor. If you are having running stomach, you go see a doctor, not the one with those self-prescribed drugs in Nigeria. So guys, the reason why I'm making this video is to also let you know that in Ghana, if you are pregnant, any pregnant woman in Ghana do not pay any hospital bill, provided you are giving birth in a Ghanaian government hospital. It is totally free of charge. And then if you are 60 years and above, you are also going to be treated free of charge. This is one good thing Ghana is doing in regards to their health system. I also made a video last year where I showed the Ghana Medical Center, the giant hospital they built for their medical students, and trust me, other citizens will also be coming in to get medical treatment as well. And that is what is leading me to talk about the medical system or healthcare system that is currently running in Ghana. When I was in Nigeria, I didn't know about anything like health insurance. I was naive. It was when I left Nigeria I came to know that health insurance really is existing. But the truth is, so many Nigerians are either not informed, I do not have good knowledge about that, do not have good education, good understanding about health insurance. I'm going to say that we have not done advertisement or marketing enough to tell people how important it is to get a healthcare insurance. So it is not rampant. For the years I was born and lived in Nigeria, I didn't get or have any healthcare insurance. Those people who really have healthcare insurance are those who are working in very big organizations, those who are working in the oil and gas industries, those who are working with MTNs, those who are working with very, very big organizations, both local and international organizations. But those who are working in just small private settings do not really have or know what insurance is about. And another thing why people do not go for these insurances in Nigeria is because, apart from the fact they are not so well informed about it, so many times they are going to claim that they are not sick or they don't fall sick. Some will claim in 3 years they have not even gotten headache. Some will claim in 5 years that God has been healing them, God has been wonderful. I am not disputing the role of God in their lives, but that is what a naive Nigerian is going to tell you why he or she doesn't seem it fit to go get an health insurance. Another reason why people are scared of getting health insurance is because, from what my friend told me, I have a friend who was working with a very big organization, I don't want to mention name, and she told me when she goes to use her insurance card, what the hospital is going to give her is paracetamol, little medications. Okay, when it is something serious, they are going to tell you that your insurance do not cover it. So with this, she personally has nothing good to say about it. She's going to tell you no, that this health insurance is a scam. So this is another belief, another reason why people in Nigeria do not take healthcare insurance seriously, and the fact that our government hasn't really thrown more enlightenment, haven't really enlightened people about the different kinds of insurance or the importance of having insurance is another reason why people are not even thinking of it. So personally, when I was in Nigeria, if you have come to tell me about getting a health insurance card or blah 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 blah, trust me, I couldn't have even gone for it because I wasn't as informed as I am now. And then if you go to Ghana, you are going to observe that despite Ghana's neighboring country, it has high penetration of insurance and universal health insurances. The question is it due to accessibility or affordability? What are the resources put into recruitment and education? What is also the budget of the NHIS scheme? Are there enough to cater for the increased demand? What are also the bottlenecks, including
bureaucratic and corruption?
In accessibility as little as 5 Ghana cedis, but without that card you are going to pay as much as 35 Ghana cedis. Polyclinics in Ghana are also quite affordable. Even foreigners in Ghana have healthcare insurance. If you don't have a healthcare insurance in Ghana and you fall sick, you are going to spend a ridiculous amount. It is just so everywhere.
I can imagine a patient in the facility who wants to do the washroom. No, the washrooms are actually a clinician. I went in the space. So that's why it's locked down. What about the one on the other side? That's for Felix. Let's see that one. We are just going up and down. No, but very comfortable. You know, when was it locked? Yesterday. So it means that people only want to.
I just called me this
Yeah, the facility manager is around. That's what's going on. He brought us here. So what's going on? You are not even aware this one is locked. No, you are not. So, like you said, you are going to it. And when we met you there, you said that's why you going to. So you couldn't even tell us at that time how it is.
This one.
Where is it? Is it this one? What is
This particular one.
So I don't have access to it.
So you already open it for you.
And so you must know, you are in charge. So you must know the development here.
Right.
If it is faulty, you must know.
Right.
So what it means is that today, as I speak to you now, all these patients, if they want to go to washroom, what would they do?
We have one suggestion that they can.
Let's go.
This is not the rich we handed over to the former administration. I must be very honest with you. This is not the rich hospital we are all boasting of. This is not the rich we made so much noise about. And rich must go back to its glory, and we will ensure that. What has changed is a typical, I've told you a lot of things. MRI is not working, CT scan is not working, and you were with me. I asked them to take me to the washroom. We walked more than 2 kilometers looking for a washroom. So that is true. During the transition period, we read certain documents to the effect that there was a program running, that program was supposed to fix all these equipment. But later in the report, and then further to ascertaining the truth ourselves, we realized that it was to the contrary. It's clear. I mean, in the handing over notes, they will tell you Global Fund is doing this, Gavi is doing this, Kofi is doing this, and as part of one of them, I remember that they said these facilities or these equipment had been fixed, but unfortunately.
Guys, look at how the health minister of Ghana is going about unannounced to all government hospitals to checkmate what they are doing there. An intentional government, a government that wants the betterment of its people, a government that wants the people to be okay. You know, hospital is a very important place. I'm going to be sharing a video of what one minister said in Nigeria about the hospitals in Nigeria. Guys, you're gonna weep when you watch the video. You're going to weep, and I'm gonna have something to say about it. Let's watch the video.
Your Excellency, let me quickly clarify this. You say that when pregnant women give birth in your facilities, they get 500 naira. Is that correct?
500 naira, yes. Yes, and the backpack.
What is the 500 naira for, sir?
Free delivery, they give you 500 naira to it could be for anything. Are you asking a poor woman what she will do with 500 naira? Some people don't have it.
Just listen to what a governor of a particular state said on the national TV. That if any pregnant woman gives birth, they are going to be given 500 naira. Do you know how much 500 naira is equivalent to dollar? 0.31 cents, not even up to $1. 0.31 cents. And in Nigeria, what can 500 naira buy? The reporter was asking him, and he said 500 naira can do a lot of things. 500 naira can buy a lot of things, can feed them a day. If I tell you that these people are very, very wicked, they don't care about the welfare, the well-being of the people of Nigeria. Just imagine how he was saying, even the reporter was shocked, 500 naira. Like you give out 500 naira to every pregnant woman, and after collecting their hospital bills without health insurance. No health insurance, nothing. You collect the hospital bills in full, and when they are going, you hand them 500 naira and snap pictures with them. Wickedness. Wicked people. This can never happen anywhere. I've never seen it happen in any African country apart from my country, Nigeria. A governor will sit down with confidence and say on a national TV that he's going to be giving 500 naira to every pregnant woman that delivers in the hospital. What can 500 naira buy? It can't even buy a bag of sachet water. It cannot buy a bag of sachet water. See, if I should explain Nigeria to you guys, you will not understand, because the more I'm talking about this, when I listen to this, I'm angry. I am totally angry. I'm boiling. Why can't they do like other countries? Look at the Minister of Health in Ghana going about to different government hospitals to checkmate what they are doing there, to make sure everything is organized and in place. It can never happen in my country, Nigeria. May God help Nigeria. That is my prayer. Let me know your thoughts in the comment section. Like this video and share.